Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Susan Fekety, the Pocket Midwife. Susan Fekety, RN, MSN, CNM, is a Yale-educated nurse-midwife, now retired after 30 years of practice. In the Portland, Maine area since 1995, she wrote The Pocket Midwife, Affirmations and Thoughts for Healthy Pregnancy and Normal Birthing in 2003, which has been enthusiastically welcomed by women and birth professionals alike. Susan holds a deep confidence in the power of every woman's body spirit to signal its wishes, desires, and dreams. For more information, please visit her website, pocketmidwife.com. So welcome, Susan, to the call. You're the Pocket Midwife, and I'm so excited for you to share your passion around birth and the story about how you created the Pocket Midwife. So welcome.
Thank you. I'm tickled to be able to tell you about it.
Mm-hmm.
Oh.
So I'd love for us to start off with you just sharing with our listeners a little bit about who you are and your experience of being a midwife for over 30 years and kind of how you got into that and what you've learned along the way.
Oh, the potted life story. That sounds wonderful. So I grew up in a medical family. My dad was a physician. My mother was a nurse. Mm-hmm. And so healthcare, bodies, medicine were always sort of in the ether when I was a little kid. And dinner table conversations were always about, patients that my father was seeing, not HIPAA violations, but, stories. And it got me started thinking really early about how medicine works and healthcare and what real healing is about and the healing relationship. And when I went off to college, I actually decided to get an undergraduate degree in political science with the intention that my energy would be spent working on a sort of legislative and policy level in healthcare in order to improve it. This was back in the 1970s when the HMO movement was just starting. So that was, it's kind of a long time ago. And what I found, the more time that I spent with people who were, for lack of a better term, kind of policy wonks in healthcare, it was really clear to me that these people were clueless about what it takes care to actually do clinical work, which I felt like I knew about from hearing so many stories as a kid. And there was just this huge disconnect between the people who were sort of making the rules and bureaucracy around healthcare as a process and with clinical work. And it was really clear to me that that was not where I wanted to be spending my time and energy, was in that world at all, after all. And I had always been very interested in women's health. This was the late 70s. The women's health movement was vital. The Boston Women's Health Book Collective had come out with Our Bodies, Ourselves. Women were really re-empowering themselves around the healthcare system, and I thought that was just the coolest thing. And so I decided that actually my mission was going to be to work from the inside as a clinician, as a midwife, and that felt to me like a really perfect way to offer the healthcare system a different model for women's healthcare than the gynecologic model that was sort of standard operating procedure. And I thought, this is perfect. And at the time that when I graduated from school and took my obligatory year off to clear my head, I heard that Yale had a 3-year program for people who were not already nurses to do nursing and midwifery combined. And so I was fortunate enough to get accepted into that very intense program. And I will never forget the very first labor and birth that I participated in just as a student nurse observer was a young woman from inner city of New Haven at Yale New Haven Hospital, 15-year-old gal giving birth with an epidural and a forceps delivery. And to me, it was so raw and so nightmarish that it absolutely galvanized me about this is a system that's got to change, and I'm ready to lean into it. So,
wow.
People a lot of times don't really remember, or it's very easy to forget or lose track of the fact that obstetrics and gynecology is a surgical subspecialty in medicine. God knows we need people who are doing surgery around labor and birth, because when you need a surgeon, I want one right in my back pocket. But it's not an illness, and the idea of using an obstetrician gynecologist surgeon sort of as the first line for labor and delivery, that's a completely demented model. It's not a good use of technology. It's an improper skill set for a healthy, normal physiologic function for women. And, more and more people need to hear about that. So over the course of time, I finished my training, went down to Texas, talk about some fairly backward obstetrical gynecology practitioners, Texas, imagine cowboy gynecologists. But I was in a very big, busy inner city setting down there as in my early years of midwifery, and I saw 3 of every labor and delivery complication that there was. It just was really extraordinary. It was a huge practice, huge volume. This was in the era when women were walking from El Salvador to have their babies because there was a revolution down there, let alone...
You were walking from El Salvador to Texas?
To Texas to have their babies, absolutely. Wow. Right, because that could, sort of plant the seed for their whole family to come up. Right. And who wanted to live in El Salvador at that time? Because it was a very dangerous place to be. So it was a real eye-opener for me as a kid from, the upper Midwest. I grew up in Michigan, to sort of see this huge, wild variety of cultures. But I was also able to see again and again and again in this very high-volume setting how trustworthy the process of pregnancy, labor, and birth is, even under some incredibly daunting circumstances for people. You see a thing happen again and again, and even though it's completely unique for each woman, there is a constancy to the process itself that is just truly extraordinary and really inspiring. So it very quickly got me hooked. And,
wow, what a story!
Yeah, there are some stories there that, it's just amazing.
Yeah.
Of course, it was exhausting and wild, but it was also quite magical down there.
Susan, I wanted to back up for a second. Yeah. When you said your dad was a physician, was he primary care?
He was an internal medicine academic doctor at the University of Michigan. So he wasn't,
Yeah.
Yeah, so not GYN at all. I mean, yeah.
And what about your mother? What type of nursing did she do?
She was a crackerjack OR nurse, surgical nurse.
Oh, got it.
Yeah.
Okay, so you didn't have a lot of that type of background, but you were called towards it, and certainly it's in healthcare, so it sounded like you were just pulled into becoming a midwife, and it just felt like your calling.
I really do feel like it was, scripted on one level.
Yeah.
Yeah, absolutely. As
cool.
for many of us who do, who do service work, I think there is that kind of draw like that.
Mhm. Oh, I agree with that.
So I practiced in Texas for 7 or 8 years, and then
as a midwife.
Yep. Then I burnt out. And needed to take a break, do some life rearranging, and in the process of that got lured up to Maine. Chris Northrup had just published her first book, Women's Bodies, Women's Wisdom, and I had a colleague who was working with her at Women to Women, which is a practice that she co-founded with some other folks up here. And I was fortunate enough to get recruited to come up and practice at Women to Women, and it was such a wonderfully perfect contrast to the kind of practice that I had been in Texas, which was huge volume, a lot of poverty, and the women.
And that was all hospital births as well, correct?
All hospital. I've always been a hospital midwife. I've always been a hospital midwife. Yeah. So anyway, so I came to Women to Women. had a private practice there, which was just so wonderful because within the context of a very progressive women's health practice, like Women to Women, and attending births at a really lovely local hospital that was very small, where the labor and delivery unit had been actually set up by nurse-midwives to be very family-friendly.
More like a birthing center.
It was more like a birthing center. So it was, for me, it was really the best of all worlds because we had a lot of latitude to create a lovely birth environment for women who were choosing to deliver in a hospital. Mm-hmm. And so I practiced there for 11 years, I think. And then it was time for me to close my midwifery practice and start sleeping at night. And I changed my practice more to gynecology and doing a lot of work with women around lifestyle and nutrition to manage perimenopause and menopausal transition. A lot of the principles that I learned as a nurse midwife working with women around pregnancy, labor, and birth actually transitioned beautifully into the perimenopausal transition because the process of change in women's lives has some constancy, and it was a reasonable thing. So during that transition for me is when the Pocket Midwife got born.
Okay.
The little book that brought you and me together. And
how long ago was that?
That was 2003.
Okay.
Yeah. So it's been around for a while. It actually surprises me to think about that. 13 years ago. Holy cow, it's almost a Saturn return. So, long time ago.
That's when I was starting my career as a chiropractor, actually. So that was a very powerful year for me as well.
Yeah.
So how did you end up birthing the Pocket Midwife?
Well, it actually had been a kind of little quiet project that I had been cooking for years while I was at Women to Women. So I am, of the era of learning about and using and practicing creative visualization, the use of affirmations, tapping into the mind-body to accomplish whatever is a desired result. And in my clinical practice with pregnant women over the years, what I found was that using focused affirmations or customized affirmations for women who had there are almost predictable, not to minimize, but there's a characteristic set of concerns that women have over the process of a pregnancy that oftentimes we have tapes in our heads or programming in our heads, usually from culture, sometimes from parents. We have tapes in our heads that lead us to places of worry, fear, limiting belief, and just a general sense of limitation and challenge. And what I found was that oftentimes those stuck, scary places were very amenable to reprogramming, for lack of a better description, by the use of a simple affirmation that a woman could take home. So I would find myself writing, sometimes not even on a prescription blank, writing an affirmation for somebody when they came in with a concern that was troubling them. And,
so a lot of it like fear regarding the upcoming birth.
Oh, there's something wrong with my baby. I'm not going to be able to make it through labor. I daren't tell my husband that I'd like him to X. I don't have enough stuff in the layette. I'm not brave enough to keep my mother out of the labor and delivery room. Whatever is the stuff that comes, I'm not going to be able to do it. It's fairly familiar probably to anybody who goes through this, because that's part of the process is confronting the places where we need to grow and going beyond them. And that's what affirmations really help women do. And so over the years, I'd work with an affirmation enough, it became familiar and it was effective, and I just kept this file folder in my desk drawer, and I would throw them in there when they came up, like, oh, I'll throw that in the affirmation file too. And eventually, I had such a file that I thought, oh hell, I should make this into a little book, and connected up with a graphic designer here in town. It's very simple. It's a tabletop flip book. It's not like a book like, that's bound that you read like What to Expect When You're Expecting, although that's probably my least favorite pregnancy book, but it's not like a book that you read. It's a book that you use. And it's sized that it can fit in your purse. It can fit in your birth bag. It can sit on your desk. It can sit beside your bathroom sink. It can sit on your dresser, your nightstand. And it's got 70-ish little individual affirmations in it. You can flip through till you find one that's resonant for what's up for you now. You can go systematically through it. But the idea is that it gives you a positive wording for working with an area of concern. So, for instance, the first affirmation in the book is, my baby is strong and healthy. Because pretty much everybody worries about, especially in the technological world of pregnancy and birth nowadays, where as soon as you conceive, you're getting the onslaught of recommended testing. It's just crazy.
Right.
We have a system that's really designed with the capability of telling a woman all the different things that could be wrong and completely lacking a skill set about reinforcing her confidence in all the things that are right.
Yeah.
So, my baby is strong and healthy is the first and probably the most important one, because it's the scary thing that we all have to go through. It's like, talk about a leap of faith. Being pregnant, getting pregnant, choosing to parent is huge. You don't know what you're going to get. Even with all the testing and control that we believe that we can exert on this process.
Right.
It is, stepping off into the unknown. And what we need to cultivate in ourselves and women is their confidence that whatever it is that comes up, they can handle that.
Yeah.
Not that everything's going to be okay, honey, but that whatever comes up, you can handle that. So there's one affirmation that appears twice in the book, and only one, and that is, my body knows exactly what to do. Because that's sort of taught out of us, I think, chronically as women, that our bodies are trustworthy and capable. That's our culture. And so I feel like as a provider, my role always was to remind and redirect a woman into that, knowing that the body knows exactly what to do, and our biggest job is to get out of the way and let it do it.
Yeah, that's right.
Yeah.
Wow.
So anyway, so that's how the Pocket Midwife got born. Yeah.
Cool. I want to know why you chose to put that affirmation in there twice.
Because I think it's the most important one. I really
More so, though, than my baby is healthy and strong. Because I think that, I do. I'm not even sure I can rationally describe to you why that, but yeah. You just know it. Got it.
Yeah, it's just, Yeah.
So give us a few other of those juicy affirmations that are in your Pocket Midwife.
Some that people have enjoyed have been, and actually my personal favorite is, I deserve to be treated like a goddess.
I love that one.
So there is a not a prima donna kind of confidence that I think a woman wants to cultivate when she's pregnant, but I think there is a transition that hopefully people will go through where they realize that they're sort of queen of their own destiny around this.
Yeah.
And that translates into becoming a personal change agent for whatever might not be supporting you in your intimate world, or in the care setting that you might happen to find yourself until you find a more appropriate one. So I deserve to be treated like a goddess is kind of totally useful, whether you're pregnant or not. I actually have that one up on my own desk all the time.
I like that one.
It just reminds, yes. Yeah. So that's one that I enjoy, and that people go. Another one that I think is really important is I trust my knowing of what is true for me. And sort of related to the testing thing that I mentioned before, women get overwhelmed with advice and instruction when they're pregnant. And I think that doesn't really serve us. Certainly, knowledge is power, but we live in a society that creates a fantasy that I think is very dysfunctional, and that fantasy is that pregnancy and birth is an intellectual process, and that there are people who know a whole lot more about what's going on in our bodies than we do. And I am a big believer in cultivating personal intuition, becoming familiar with that sort of gut level, what's right for me place that we all know where it is. We know what it feels like. But oftentimes we'll try to talk ourselves out of it, or, you know, in an instance might be willing to kind of give away our power there and then learn the hard way that would like, oh, oops, that was not really what I wanted to do. So I think as women cultivate the sort of mother wisdom, their own mother wisdom that they will use when they parent their child that they ultimately have, that knowing what is true for me, that they learn while they're pregnant, giving labor, and giving birth, when they cultivate that gut level knowing of what is true, is what's going to stand to them in their stead when in the right place when they're doing things like disciplining a child, evaluating a difficult situation, dealing with something that another parent has said, or when the kid comes in and says, well, everybody else's mother's letting them blah, 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 and they say, you know, I know what's true for me, and you're not doing that. That mother wisdom, that mother bear wisdom is really something that you start learning that really early on in the pregnancy journey.
Yeah. Wow, that makes so much sense. And so it's, you know, thank you for sharing that perspective. It's really like the pregnancy is an opportunity not just to grow and make a baby, right? There's an opportunity to grow and make a mother. Exactly. During that pregnancy, actually, so that by the time the baby arrives in the world, this mother has already had time to learn what is important to her, her values, what her family values and morals and ethics are, so she can really stay true and strong to that and not be swayed so much by cultural pressures around us.
Absolutely.
Wow.
Absolutely. And ironically, you know, we live in a birth culture, many of us, in communities that are, you know, less than progressive, where we have a lot of opportunities to figure out what's right for us and what's not. You know, sometimes by encountering the profound contrast between what we know we prefer and what we see in front of us.
Yeah.
So that's a way to learn, although it's not the most pleasant one.
That's so fascinating. So, is there any other lessons that you feel called to share that you've you know learned years as a midwife, as a woman, as a mother?
Well, I'll re-say the one that I think is the most important, and I appreciated your asking me this as I prepared, because it was useful for me to try to distill down to, you know, essential knowledges. But, you know, the most important one is that the process is really very trustworthy. I have a friend who says, you know, you've got 4 million years of evolution in your back pocket. And that is so helpful. You know, it's like we've been doing this for a really long time. It's pretty perfected.
It's not
pretty
new.
Perfected.
Yeah.
And so that is a very useful thing to, you know, sort of have as a touchstone. I think it's really important for people to remember, and I think this is where affirmations come in very usefully, and that thoughts do count. You know, we're learning that that energy and matter are the same things, that we can learn how to manifest what we want or what we worry about just by keeping that in the energy field. And I think it's a really lovely exercise for people, an essential exercise for people to learn what it is that gets you to your place of spiritual tapped-in-ness, however that looks for you, and gets you back to home. So, so learning home base is really essential, and you can practice saying things like, this particular line of thinking that I'm engaged in here, not really beneficial to me. So how do I get back home to what I know is really big picture true? But knowing that thoughts really count.
I think that is so important. I'm just thinking that there might be some women listening right now that are like, I have no idea how to get back home. Like that seems so maybe overwhelming for some women, like if they're just feeling very lost. Do you have any like other exercises for women that are feeling like, how do I get home?
I would form it in whatever I would say is put a quiet time into whatever practice says to you prayer. Because that's going to get you to your meditative heart home. So however you can get, and it doesn't have to take a long time, 15 minutes with the door shut, breathing, you can often get back to home.
Oh,
because
that's so beautiful.
It's always in you. It's always in us.
Got it.
It's always in us.
Yeah. Perfect. Thank you.
That place to get.
Right.
And once and it's a learned process too, Laura. I really think learning how to get there is something that we cultivate. I think it's much more important than Lamaze breathing. It's like really like, how do I find what my true authentic voice is? And what keeps me on this journey? Like, why did I decide to do this in the first place? Sometimes too, I think when we're talking about things around pregnancy, labor, and birth, this is an area, this lack of lost home is a place where your birth allies can really help you. So, to the extent that somebody might be feeling, befuddled, confused, frightened, this is where your doula, your midwife, I'm guessing if people are lucky enough to come to you, your chiropractor, who has a vision of the powerful, connected, tapped in you, can help you identify that sense of strength. Sometimes it takes a little external validation of, you can do it, you do know, you do have this within you, to help you kind of nurture your own inner confidence that indeed, yes, you do.
Yeah, you're right. And that's really a birth team that ideally a woman is creating during her pregnancy.
Absolutely.
Of not just the birth provider, like a midwife, but the doula, certainly a maternity chiropractor, an acupuncturist, prenatal yoga instructors. I've seen them work magic with women during pregnancy on that empowerment. So, there's all types of practitioners out there that we love doing this work and having these conversations with women during pregnancy. There's a hypnobirthing specialist in my office, and he does this work through hypnosis. Beautiful. And exactly. So there's so many different ways out there to do it. But if you are feeling lost, look for some support around you. Look for other women that are, having this strong, feminine energy that are wanting to help lift you up and help you feel like, hey, I do have the power. Like helping remind you. They're not giving you power. They're helping remind you that power is already within you.
It's already there.
Yeah.
Yes. Yeah. And sometimes that, so the next step beyond that too is, as you're thinking about assembling your team of allies for this journey, sometimes what that calls for is for a woman to say, to herself, first, this particular energy is not beneficial for me. And sometimes the clean warrioress needs to say, you ain't on the team. You got, sister-in-law, sorry, or something that is not helpful to me. And again, that's that cultivating that inner intuition about what works best for us. But it is as important to identify who's in your inner circle as who does not have the privilege of being there. And I would always be delighted when a woman would show up in my practice in like 32, 36 weeks, having done her prenatal care someplace else and finally got to the point where she said, this is just not my model. I need to go somewhere where they think like I think about this process. And I think women are a lot of times really scared to shop around and to switch. And I'm here to say, do it until you get what you need. Move around. It's so important. It's so important that a woman.
It is. Finding a birth provider whose philosophy matches your own is really very vital during the birth. And so that's ideally something that's happening pre-conception, first, early second trimester, right? Like the earlier the better. Like start going in and interviewing people, and don't feel guilty about firing your doctor if they don't match your philosophy. It's okay.
Totally. Right. It's totally okay. They're probably relieved because, then you're one less person they need to worry about. But yeah, this whole process is not about being a nice girl. Nice girl is not at the party. Right. This is really about figuring out what's right for you, what's authentically right for you, and doing what you need to do to set that up. Mm-hmm. And so the more that you can do in that direction, the better. So yeah, shopping around, moving around is absolutely essential. Mm-hmm. Another thing that I think is helpful, I'm thinking about the lost person that you mentioned a moment ago, and I think another thing that we often don't tap into as often as we could is the personal power that we can cultivate by spending time in nature. And I think that's particularly true for pregnant women. Now, dead of winter is not the greatest time to be going outside, but there is something about being in a natural environment and, reflecting upon how your body is part of this same evolution that you see and the magic that you see all around you. And really tapping nature for role models. Sort of related to affirmations, one of the things that patients of mine, I hate that word, clients of mine, would often do would be to identify a power animal or an animal totem, an animal who had characteristics that inspired them, that they would sort of keep an image of, wolf, bear, lion, some animal that's like, say, we're relatives. The qualities that I see in you that I really admire, fierceness, nurturance, power, directness, I want to bring that in for myself. So, connecting up with nature, however that looks for you, can be really valuable. So, another thing to keep in mind.
That is really important. And, for me being in the New York City area, it's so easy for us women living here to not get enough time in nature, because we actually have to make a little more of an effort. And so, but I hear that, and I think that that's such an important message for women to hear, that if you are living and working in an urban environment, no problem, but you just do have to schedule time maybe on the weekends to, go get out in the country and get out in the fresh air and ground when the weather's a little nicer, get those bare feet on the ground, in the grass, and connect to Mother Earth. How powerful, right? Mother Earth birthed all of the creation around us, and that's what an inspiration for a woman during her pregnancy.
Mm-hmm. Exactly.
Yeah.
Exactly.
That's a great reminder. So, any last lessons or thoughts you want to share with our audience?
I want to mention, just because this is something, prenatal care model that I think is really wonderful, and I want more people to know about it, and it leverages some of the things that you and I have touched on as we talked here, and that's a new way of doing prenatal care called centering pregnancy, where rather than doing one-on-one visits, with women isolated in exam rooms, it connects women do their prenatal care in groups, like a group of 8 women or 8 couples who are pregnant about the same amount, and it combines education, support of the women with each other, and the clinician is usually also attends the groups. We did this for several years when I was at Women to Women, and the women loved it, and the clinicians loved it, and the labor and birth outcomes were better because I think there is something really magical that happens when you gather women together in a group. So, centering pregnancy, if there is a centering pregnancy group around you or a practice that offers that, that is worth looking for. And they have a website, centeringpregnancy.org, where you can find where practices are that do it. But it's a model that is really sweeping the nation because it makes so much sense. And it's so, and women like it so much once they do it. So that would be a thought to look at.
Believe it or not, I've never heard of that, and it does make so much sense. I've been to a lot of functional medicine forums where in general they've talked about the future of medicine moving towards more group medicine, which is what you're discussing. And they weren't referring, I had never heard it in the context of pregnancy, but it was more like a group of people that were all having the same, like diabetes or another, an autoimmune disorder or something like that. So everyone in the room had a shared medical history and were able to support each other, hold each other accountable, and then the education for the patients was all done in a group setting, which was actually really time-saving and valuable for the clinician. Instead of having to repeat themselves 8 times, they could give that information to the group. Exactly. So I have heard really great models about that, using it for other healthcare situations. So why not pregnancy? A group of women that are, like you said, around the same time of their pregnancy, they're all around the same week into their pregnancy, can be around each other, learn from each other, share resources in their community with each other. I mean, that makes so much sense.
It's really powerful and wonderful. So I hope everybody will hear more about that soon, because it really is. It's been around for, I think I did my first centering group in 1997. So it's been around for a while. And I think it's something that it really, as time goes by, is going to become more and more popular. So it's useful. The reality is that, like I said, there is such commonality among us, and what comes up, even though each of our individual circumstances are unique. What binds us together and the similarities that we have with one another is bigger, I think, that to differentiate us. And that's, I used to call centering sort of prenatal care for peace. I really think it's leverages a social model that's really special. And I think, folks with diabetes shouldn't be the only ones who get group care. I think we all probably use it.
No, but that is so true. And what I also like, and you and I can really appreciate this as healthcare practitioners, it's a lot of stress on practitioners to have to deliver and educate and do all of it in a one-on-one setting. And it can be exhausting. So if we can also help support clinicians in getting this information and education across to more people, it really just makes so much sense. It's better time management. Right. Yeah, I love that.
Yeah. It requires a person to relinquish the idea that they're in charge, and that's a process. But I think that's a really good process.
That's important. Yeah. Exactly. It's about empowering the patient, you give them the information, but then they're on their own to make all those lifestyle choices and of what they're doing outside of the office, right? And that's all up to the person of what they want to put in their body, what they want to think, how they want to move their body, everything, involving that.
Yep, their time frame. Exactly.
Yep. So if a woman's listening and she just can't wait to get her hands on one of your Pocket Midwife books, how does she find it?
The simple website is www.pocketmidwife.com. Very easy, and you can order it individual copies, or I have birth providers who order in bunches to give as client gifts. It makes a great gift for somebody who's pregnant, or you can just order it and I'll send it to you. Or if you want to send a gift copy to somebody and enclose a note, I can do that. So pretty easy to do. I do all the shipping myself, so it'll be handcrafted. I can sign it if you'd like.
Aww.
Yeah.
Susan, I love it. I mean, I just feel like it's, this book was really created from your heart, and not only that, but you're actually like packaging and shipping these little books yourself too. It's from Maine. It's really heartwarming.
It's a lot of fun. It really does sort of feel like a labor of love to me, and I'm tickled every time somebody, orders a copy, and I get to imagine it sitting on their nightstand or wherever. So, yeah, it's fun.
Yeah. Awesome. Well, thanks again for coming on the show and telling us about, just sharing with us about your experiences and your wisdom and your affirmations. I love it. I really appreciate it.
Oh, Laura, thank you. And I really feel like, it's people like you who are going to sort of shift the balance toward the good for all of us. So thank you for the hard work you're putting in on behalf of women this way.
Thank you.